Today I'm remediating week 4, dressing change, OSCE. Step 1. Check supervisor's original order regarding wound care and for client allergies noted in the chart. Moving on, the student sets the environment to promote patient safety and confidentiality by drawing the curtains and closing doors. The student introduces themselves formally using their full name and identification as a student from the specific institution and states their role. Then they proceed to be dressed in a professional manner wearing proper ID. Moving on, the student uses appropriate biological safety procedures and sanitizes hand until the gel is dry. Moving on, the student identifies client using 2 identifiers, one being name and date of birth, and verifies allergies to medication, tape, latex with client. Moving on to step 5, explains procedure to client and ensures client consent to treatment. The student assesses client's need for anesthesia prior to dressing change and asks client if they need to avoid properly prior to procedure. Step 7. The student gathers necessary supplies and states they reviewed previous charting to determine what will be used and checks integrity of supplies and for any tear, stains, and expiration dates. Lastly, obtains appropriate solution and performs the first check. After adjusting the bed to proper height, the student positions client comfortably and provides privacy by closing curtains and only exposing the wound site. Moving on, the student properly opens dressing wound tray and sets up sterile field by using aseptic technique. Student places sterile drip under or next to the client wound site, as indicated. The student removes garbage bag and puts it within reach of the work area between the client and sterile field. The student prepares the solution, normal saline, as needed, pours off into bag, performs second and third check of saline before and after solution is poured. Second check, pour off into garbage bag, and perform a third check. The student opens gauze and any other needed sterile supplies and drops them 6 inches or peels back and uses forceps to place them onto sterile field. The student demonstrates procedure for removal of old dressing change and including don clean gloves and other PPE as needed and remove tape gently towards wounds supporting skin and remove and assess old dressing, noting drainage amount, color, consistency, and odor if present. For the sake of this video demonstration, I do not have access to proper materials and cannot perform this part of the OSCE, although I will be explaining the procedure. Using this mask as an old dressing change, I will peel off the tape and roll the dressing change backwards on a diagonal angle. After that, I would roll up the dressing change, tuck it in the glove, and dispose of it accordingly in the garbage bag with the glove. After disposing of the old dressing wound and the gloves, I will demonstrate hand hygiene after disposal of the old dressing and don on clean gloves. Moving on, I will identify the type of wound, for example incision, abrasion, puncture, ulcer, and partial thickness, full thickness, wound stage, and presence of staples or sutures if applicable. Although I don't have a wound present in front of me, in a normal environment and at a wound site, I would assess peri-wound skin using pre-to-mount, pain, redness, ecchymosis, edema, drainage, approximation, measurement, odor, white blood cell count, and temperature, and discusses what is clean versus dirty. Moving on, I need to cleanse my peri-wound with cotton balls with my forceps dipped in saline and cleanse from the outside first and dispose of the cotton ball. After repeating this step, we need to dry our wound with a normal cotton ball and dispose. After this step, the student will be required to measure the length and width of the wound. After properly cleansing the wound, we will now be applying the dressing change, the new dressing change. After applying the new dressing change, we will now secure it tightly with tape. After properly securing the new dressing change, the student is responsible for labeling the dressing change with the time, initials, and date on the tape. Following, the student disposes of equipment properly and doffs gloves properly and then performs hand hygiene. Moving on, the student repositions and appropriately covers client and puts up side rails and lowers bed in if required, and gives client a call bell and cleans surrounding area. Lastly, the student uses therapeutic communication techniques, communicating with the client with dignity and respect during dressing change, and asks client if they have any more questions. If not, the student can proceed to document